What is hospice? Presented by Good Samaritan Hospice. What is hospice? Hospice is a program of care and support that you may want to consider if you or someone you care for is terminally ill. This information and the support given by a doctor and a trained hospice care team can help you choose the most appropriate health care options for someone who is terminally ill. Hospice provides comfort and support services to individuals and their families who are terminally ill. It helps them live out the time they have remaining to the fullest extent possible. Hospice is provided by a specially trained team that cares for the whole person, including his or her physical, emotional, social, and spiritual needs. Hospice seeks to improve the quality of care. It neither hastens nor postpones death. Hospice treats the symptoms and not the disease. Is hospice for cancer patients only? No. Many different diagnoses benefit from hospice care. Patients with illnesses such as CHF, COPD, emphysema, dementia, failure to thrive, and many other diagnoses are eligible for hospice care. Are all hospice patients elderly? No. Patients of all ages benefit from hospice care. There are no age requirements. A patient should consider hospice care if any of the following conditions exist. Activities of daily living have become difficult. Pain is not well controlled. Symptoms are increasingly uncomfortable and difficult to manage. Treatment will no longer cure the disease. When should hospice care begin? The decision to request hospice care is a personal one. Ideally, hospice care should begin when the focus changes from treatment of the disease to treatment of the symptoms and the comfort care. Generally, the earlier the patient and family begin hospice services, the more they can benefit from them. Well, what is the first step? The first step is an evaluation to determine if the patient in question is hospice appropriate. If so, you will have a specially trained medical team and support staff available to help you and your family cope with your illness. Can anyone make a hospice referral? Yes. The patient, a family member, friend, or a physician can ask for hospice care. The patient's own physician must approve the admission and is encouraged to continue to actively manage the care provided by the hospice team. Where are hospice services provided? Care is provided wherever the patient calls home, and that may include their own private home, nursing home, assisted living facility. What services are provided? Well, hospice provides medical care. Skilled nursing is also available 24/7. Pain and symptom management, medical equipment, and supplies, as well as medications related to the diagnosis, therapy, hospice nursing assistance, and light housekeeping. Other services involve emotional and spiritual support, such as respite care, chaplain services, social services, family support, and bereavement support. Can I still see my doctor if I'm on hospice? Yes. Patients can continue to utilize their primary physician and hospice services if needed. Well, who pays for this hospice? Hospice is paid for through Medicare hospice benefit, Medicaid hospice benefit, and most private insurers. What expenses are covered? Pain management, anti-anxiety medications, symptom control medications, all supplies, including wound care, incontinence, and stoma supplies, as well as all medical equipment, which includes beds, walkers, oxygen, bedside commodes, lab and diagnostic, testing, transportation, ambulance transportation. Good Samaritan Hospice of Madison. Well, why should I choose Good Samaritan Hospice of Madison? Well, for several reasons. The first reason is Good Samaritan Hospice of Madison is locally owned and operated, conveniently located at 540 Hughes Road in Madison, certified by Medicare and Medicaid. Hospice support just a phone call away. Hospice experienced registered nurses and hospice aides. Professional and personal services. Inpatient palliative care, if needed. Continuity of care. Local hospice and nursing home affiliations. Bi-weekly medical reviews by all team members, including medical directors. Monthly grief support meetings. Monthly caregiver support meetings. Hey, just give us a call at 256-772-8108. Thank you very much.